Hello, everybody. I hope you can hear me okay. I'm going to be talking today about trajectories in mental health and socio-spatial conditions in a time of recession and austerity. And this is research using the USS data on residents in England between 2011 and 2017, linked to geographical indicators. I'd like to acknowledge inputs in the formulation of this study from my colleague Niall Cunningham at Newcastle University. The research I'm going to report has been published in Social Science and Medicine. And you can see on this slide a list of all the other co-authors for this paper, Jamie Pierce, Peter Condon, Mark Cherry, and Sarah Atkinson. So thank you to all of them for their help with this work. As we're using the USS, we always acknowledge the USS as one of our sources, and we'd like to thank the staff of the USS who helped us very much in putting together the data that we needed for this research. Obviously, the interpretation of our results is our own. I'd also like to acknowledge the NOMIS Centre at the University of Durham, which helped us with access to ONS data on geographical areas, and a special recognition as well of work by Christina Beattie and Steve Fothergill at the Centre for Regional Economic and Social Research at the Sheffield Hallam University, because they generated one of the geographical indicators that we've used relating to the impacts of welfare reforms. The research question, which I'm going to be talking about, concerns whether individual trends in mental health were associated with geographical indicators of local unemployment and the impact of austerity measures on average incomes in the local authority areas where people live. The outcome indicators for this analysis are generated as trajectory groups over time, looking at trends in the SF12 mental health component score. And this was collected, as you're probably all aware, for individuals at each wave of the USS, and individual trends in the score between wave C and wave G, so 5 observations, were categorized using group-based trajectory modeling. For those of you interested in this technique, there's a reference to work by Jones and Nagin at the bottom of this slide. The results reported here are derived from a model which classifies individuals into 6 categories according to trend in their mental health. And here's a graph that represents those trends over time. There are actually 6 trajectory groups identified in the model that we used. We're going to focus on 2 of those in particular. There's group 6, which is outlined in red at the top of the graph. These are people that were enjoying constantly high, relatively good mental health throughout the study period. And we're going to be contrasting them with those in group 3, which you can see as a green downward trending line, representing a group of people whose health declined, started off fairly high, but declined over the study period. We do have results relating to the other trajectory groups as well, but I don't really have time to discuss all of those today. The method of analysis used the mental health trajectory categories as categories of the dependent variable in a multinomial logistic regression model, which we carried out in Stata. Selected results reported below to fit into the time, and they're testing the association between predictor variables in our model and individual membership of group 3, the declining mental health group, as compared to group 6, who were always in good health. The predictor variables included indicators of geographical conditions, where the person lived, and individual attributes, which are also likely to relate to mental health and mental health change over this time. The geographical predictor variable of particular interest then is a measure of area disadvantage, comparing indicators of local unemployment and measures of impact of austerity on incomes during the period 2011 to 2015. The measure of local unemployment is based on the index of multiple deprivation from 2010, actually drawing on data in 2008, which is about when the Great Recession set in. And we're drawing on the employment subdomain index based on data about welfare benefit receipt in relation to unemployment. And that's published by NOMIS at ONS. And our second indicator is at the level of local authority districts, so rather larger areas. And this is the data on the average loss per person of working age due to welfare reforms. And it's published, as I mentioned earlier, by Christina Beattie and Steve Fothergill at Sheffield and Hallam University. So this slide represents maps of those two indicators. On the left-hand side, you see the index of multiple deprivation, IMD, for 2010, looking at employment deprivation, really in 2008, and it's for local super output areas, so we can think maybe about that as neighbourhood deprivation in terms of problems of unemployment at the beginning of the recession. The right-hand map is showing us information for larger areas, local authority districts in England, and it's representing in quintile groups. Both maps, I should have said, are representing quintile categories of each measure. So the right-hand graph map is quintile categories of income loss on average due to welfare reforms for the population in those areas. As you look at the maps, you can see, of course, that the IMD data on the left for smaller areas is a finer grain patterning of inequality as compared with the map on the right. And if you look at the most deprived red shaded areas in the map on the right, and then compare it with what you see on the left, you can see that actually there is variation even within the most deprived areas. Not every locality was also in the most deprived category in terms of unemployment at the beginning of the period. So this is actually quite a complex measure, a set of measures of inequality in terms of economic conditions. We explored the relationships of these with mental health change, and we found that a good way to bring together those two measures and express their relationship to the mental health outcome was actually to divide our sample into two groups, one living in areas of lower disadvantage and one group living in areas with greater disadvantage. And the greater disadvantage group, for example, if we look at the quintile in terms of loss of income during the period of welfare reform and austerity, we can see that larger proportions of the greater disadvantaged group are in the most deprived fourth and fifth quintiles. Sorry, I'm just going to go back a step. I think we've missed a line here. Yes, here we are. Here is another graph which is showing us this time the employment at the beginning of the study period or unemployment at the beginning of the study period. And if we look at the greater disadvantaged group, there are more people living in neighbourhoods with the highest level of employment disadvantage. So you're getting a combination of those two factors operating at different scales expressed in these measures of disadvantage. We examined whether risk of declining mental health versus stable good mental health was associated with living in areas of greater versus lower disadvantage. And we also controlled for a number of other variables which were shown to be in preliminary analysis to be likely to be important. There were other geographical variables that we considered, in particular urban versus rural location. We explored, and we found that actually the areas that showed a rather different pattern were people living in small towns in rather more semi-rural settings seem to show advantages in terms of mental health and be less likely to have declining mental health as compared with either urban areas or extremely isolated rural areas. We also found that the risk of being in the declining mental health category seemed to be associated with the region of residence, and in particular, the difference between living in the West Midlands area as compared with the regions across the rest of England. The West Midlands is an area where recovery from the recession was particularly slow. We also need to bear in mind that we're adjusting in the model where I'll present results for a number of individual attributes. We're controlling for self-reported sex, male, female, age group, 10-year age groups, self-identified ethnic group in fairly broad categories, whether the person lived with a partner, their occupation and social class, their income in the month prior to interview, their employment status, their housing tenure, in particular, whether they were home owners as opposed to owners or people paying mortgages on their homes, and whether they were in receipt themselves of welfare benefits. We didn't include child benefits and state pensions, which are rather universal benefits, but those relating to greater deprivation were included in our analysis. So quite complex models, including other geographical and a number of individual variables. This table is summarizing the results, and I'm not showing you the whole table. It would be almost invisible on the screen, I'm afraid, because it's quite complex. After including the other area variables and individual variables, these are the relationships that we are finding. So we find, for example, that those who live in towns, in rural areas, are less likely, shaded in blue, they're less likely to be in group 3 with declining mental health relative to the group 6 in constantly good mental health. We also find that relative to other regions, those living in the West Midlands, outlined in orange, are more likely to be in the declining mental health group. Then we come to the area, the indicator of particular interest to us, which is whether they were living in an area of greater disadvantage or lower disadvantage in terms of the economic conditions. And we find that those living in areas of greater disadvantage were more likely, significantly more likely to be in the group showing declining mental health as relative to the group with stable mental health. We also examined the impact of residential mobility So you see that the first blue star is against an indicator which shows whether people were residentially mobile between local super output areas ranked in different quintiles by the employment domain. And those who moved into another LSOA, which was in a more deprived quintile than the one they had left, were more likely to be reporting a decline in mental health. Then the last part of the table shows us residential mobility between local authority districts as ranked in quintile groups by welfare reform income loss. And those who moved to the less disadvantaged areas were significantly less likely to be in the declining mental health group, whereas those who moved to more disadvantaged areas were significantly more likely to be in the group that was suffering a decline in their mental health. So there does seem to be some significance associated with our indicator of economic disadvantage in geographical areas after controlling for a number of other factors here. So to conclude then, first of all, it's probably worth noting that this is a complex pattern of association between mental health, individual attributes and area conditions. I haven't had time to discuss all the individual associations as well, but we were finding some interesting results there too. The risk of declining mental health compared with stable good mental health is positively associated with residents in areas of greater disadvantage. And we noted that social mobility is also important. And we have also noted that things were worse in terms of declining mental health for those in the West Midlands and better for those in towns and rural areas. So local conditions as well as individual attributes are likely to be important for the mental health of individuals. And when we come to discussion, you might be interested to raise questions including the following. Does economic disadvantage at community level associated with the recession and the subsequent period of austerity, is this something which health service management, resource allocation and planning be more sensitive to, in addition to thinking about the individual characteristics of the population and the kind of service use that they tend to make? So thank you for your time and for those who have organised this very interesting session for us. And I'll pass back to the moderator. Thank you.